Hi, my name is Thelma Egbuchua, and I would be discussing an approach to failure to thrive. Before we start, please note that this video is only for educational purposes and not a real exam situation or a means to give medical advice. Please consult your doctor for any medical advice you may need. Thank you. So we'll be discussing a case scenario to help us solidify information. A mother brings her 2-year-old child, Jake, to the clinic, worried about his weight. The task is to take a focused history and counsel the mother in 11 minutes. Skills tested usually are communication skills, knowledge of the subject matter, and data interpretation. What do we expect for this station? There is a 2-minute pre-encounter, and then there's a history and counseling in 11 minutes. In these 11 minutes, you do not get to communicate with the examiner, you just speak to the patient throughout. Okay? So, what happens in the 2 minutes outside the room? You want to understand the task given to you. So this task says history and counsel. You want to write down the name of the mother so you don't forget it. You want to write the age and gender of the child, if at all it's given. The scenario, are you in the clinic or the ER, and the task assigned to you. Then try to pen down possible differential diagnoses. This would help you to have a list of questions to ask while you go into the room, and have a format for your history taking so you do not miss important questions. So when the bell rings for you to go inside, always knock on the door. And when you enter the room, what you do? First off, you sanitize your hands, and then you give your identification sticker to the examiner. Introduce yourself to the patient always, and ask for the child's name and age if you don't have it, and ask how the patient likes to be addressed. And then you start taking the history. So this section should be like 30 seconds to 45 seconds max, so you have ample time to discuss with the patient. So in taking the history, you want to know what the chief concern is. So in this case, the chief concern is that the mother is worried about the child's weight. Try to be empathetic. What's your worry exactly? How do you feel about your child's weight? Before you start asking all of the medical questions, try to make the mother feel at ease. So you want to ask or know when it started, or when the mother noticed that the child wasn't gaining weight. Then you want to analyze the weight. The weight today, the weight at birth, the weight at last visit, and the highest weight the child has ever weighed. You also want to analyze the height today, at birth, and at last visit. And always ask about the growth chart whenever you have a history regarding weight or height, because this would give the examiner the idea that you know what you're talking about, and also because you can only diagnose your failure to thrive by looking at the growth chart, basically. So failure to thrive is weight below the 3rd to 5th percentile for weight, or a fall of the weight greater than 2 major percentile lines in 6 months. Could also be weight less than 80% of the ideal weight for age, and or weight for height below the 5th percentile. So these are like various definitions. You can always pick which of them it's easy for you to recall and discuss with the patient, that the patient actually understands. Then, continuing your history, you want to ask about associated symptoms if present. Common associated symptoms you'd want to ask are diarrhea, vomiting, abdominal pain, or any bluish discoloration of the mouth. You want to assess for the impact of this weight loss on the child. Is the child drowsy or playful? Also very important is to rule out constitutional symptoms like fever, night sweats, lumps or swellings in any part of the body, which indicates lymphadenopathy. So this tells the examiner that you're trying to rule out malignancy or any chronic diseases. Then you want to review the systems. Starting from the eyes, you're asking about red eye or eye discharge, any ear discharge or pain, any nosebleeds or running nose, any swelling of the tongue, in the mouth, any rash on the skin, chest symptoms like cough, wheezing, cardiac symptoms like bluish discoloration, sweating while feeding, any reduced urinary output or swelling of the body, any musculoskeletal symptoms you may remember. So all of this helps you figure out or rule out acute infections, chronic infection. And then you want to go ahead to review your differential diagnosis. Common differential diagnosis associated with failure to thrive is 1. Inadequate caloric intake. 90% of the time, FTT is as a result of non-organic causes, and so you want to dwell on the nutritional history properly. To rule out congenital heart disease, like I earlier mentioned, you want to ask about bluish discoloration or sweating while feeding. To rule out celiac disease, you want to ask about chronic diarrhea and bulky stools. To rule out cystic fibrosis, you want to ask about recurrent respiratory infections. To rule out malabsorption, you want to ask about pale bulky stools. To rule out lead toxicity, you want to ask about living in a really old building. So all of this can just help you narrow your differentials and rule out the unimportant ones. Now to the bind aspect of the history. Bind means birth, immunization, nutritional history, developmental history, and environmental history. So this aspect of the history just encompasses everything you may have missed in the chief concern, and then every other important thing you may be thinking about. So asking questions around the birth, you want to know the prenatal history. But first of all, you want to ask if this patient is the child is the biological child of the mother, or if he was adopted. So rule that out before you ask about pregnancy, okay? So you want to ask about the prenatal history, any fever in pregnancy, any hypertension, diabetes, or smoking or alcohol use in pregnancy. Any history of prematurity, what was the child's birth weight, and any history of meconium passage. You want to ask about the immunization history and the nutritional history. So dwelling on the nutritional history, you want to know what the child's daily diet is like, and what the child's feeding habits are, the quantity of food the child takes on a daily basis. Does the child eat junk food, sugar drinks? Is he or she a picky eater? Any difficulty swallowing, to rule out cerebral palsy or any neurologic diseases. So the nutritional history is so important in this case that you do not want to miss any important points. So you also want to ask about developmental milestones the child may have achieved and how the child behaves in social interactions. You want to ask about the environment. Really important is to rule out child neglect, because this is one of the major causes of failure to thrive. Also want to ask about smoking and alcohol use around the house. and also to rule out constitutionally small child. So if the height and weight of the family members are also small, then this child may just be healthy and be constitutionally small like the parents. So having that in your history is really important. You also want to know the level of education of the caregivers, their socioeconomic status, to rule out poverty and the likes. Now you've gotten your history from the patient, you now want to talk to the patient. So 90% of the time, failure to thrive cases are as a result of non-organic causes. Common ones are child neglect, like I earlier mentioned, inappropriate feeding technique. This usually is for younger children who are still maybe breastfeeding or bottle feeding. Then you want to rule out inappropriate nutrient intake. So this inappropriate nutrient intake is what we could be dealing with in this situation. Poverty is also a common cause, and then disturbed parent-child relationship. You want to explore all of these options and ensure you talk to the patient and rule anyone out. And then when you've gotten your differential, the most leading differential, you want to now talk about it. You want to educate the patient on proper feeding techniques, how to feed, when, what to feed. Always give the patient guidelines on Canada's food guides to guide dietary intake. Doing this would let the examiner know that you have an idea about Canada's guidelines, and it's always a very good pointer. Also want to discuss referral to the dietitian, and then you want to take blood samples for serum electrolytes to ensure that all the child's electrolytes are stable, and if the child is going to be hospitalized or not. You also want to rule out a thyroid disease, impaired glucose tolerance, or hypoglycemia. You want to do a metabolic screen to rule out metabolic causes, and then genetic testing if necessary to maybe rule out celiac disease or cystic fibrosis if you are suspicious of it at all. Then, like I said, if you feel the child needs to be hospitalized, always mention it to the parent. And finally, you want to connect the family with community resources. So in cases of maybe poverty, you want to connect with the social worker to see how they can up their finance, and maybe connect them to food banks where they give them food, and always try to teach them the proper way to feed, and try to limit junk foods and sugary drinks in the child's diet. So we've discussed all of this. Important tips to note is that you always want to be empathetic. You do not want to make the mother or the caregiver feel like they are the cause of the child's problem, or they don't know how to care for their child. So you need to be empathetic and be kind. You want to be open-minded. You want to be supportive, and always show the parent that you are here to support them all through the journey of gaining back the child's weight. And always thank the patient for sharing information with you and for coming to the clinic. So this is the end of this discussion. I hope you're able to pick one or two things to help in preparation for your exams. Thank you for listening to this video, and good luck in your examinations. Bye.